analyzed.
And if I may, I would like to keep on where Babette left, because time is certainly of essence. And time was also the topic of the student voice that we heard. And it's so refreshing to also have the student voices represented here today. Because we have to think along the time dimension of the health of the children today and the health of future generations. And we have to do this, of course, in a global context. And that is what this very session will be all about. For the interest of time, speaking of time, I will skip the rest of my introduction. We are lagging a bit behind schedule, so I will give privilege to the panelists. So if I may, I would like to introduce the first panelist immediately.
Yes.
And the first panelist, and we are very happy to have
Karin SIPIDO, je crois.
Exactement.
Yes.
Professor of cardiology at University of Leuven, but also a professor who has been working on very many levels of policy in Europe. And you chaired the Horizon 2020 Scientific Panel for Health, among other things. It's a pleasure to have you here. Please.
Bienvenue sur ce plateau.
Merci beaucoup. Thank you, Rhoda, for introducing me, and I'm very happy to be here. I don't know if it's possible to get some slides. I saw there were some difficulties before. But let me start by saying that I want to talk about health research. If we want to have global health and want sustainable health, research must be part and total of a European Health Union. When we worked as a scientific panel for health under the Horizon 2020 program, we came up with a number of recommendations, and they were even more acute and sharply and relevant, made relevant during the COVID crisis. And I named 4 of them here. And I'll start at the bottom. The first is, if you want performant health research, then you need to have a strategy that ensures continuity and a long-term investment. It doesn't happen overnight. You have to ensure there is translation and innovation, that it comes into new products, new treatments. And you have, and this is a very sore point within Europe and within the world, you have to address fragmentation. Fragmentation across sectors, fragmentations between countries, and you have to ensure there's collaboration because it is much more powerful. And I'll end with my number 1 point. You need vision. You need vision and a leadership that ensures that something is going to happen. So these recommendations were made in July 2020. Where are we now? In October 2020, can I have the next slide, please? Yeah. So in October 2020, the Commission President Ursula von der Leyen made a statement that we were going to build a European Health Union. If you look at the subtitle underneath, you see it is about protection of the health of Europeans, collectively responding to cross-border health crisis. And this fits very much in the remit of the European Union, which, if I can remind you, doesn't really have a large competence in the area of health, which belongs mostly with the countries, member states. And we have the ministers meeting here tomorrow. So if we want a European Health Union, the countries must devolve some of their autonomy to a European strategy. We need a European Health Union. And the first step, staying within this remit of being a protection of health and safety, there is a proposal, and very far advanced, to build a European Health Emergency Preparedness and Response Authority, HERA. HERA reminding also of the goddess Hera from ancient times. It's about getting ready for emergencies. Along with that HERA comes a strengthening of ECDC, the European Center for Disease Control, and the European Medicines Agency. This is an integrated response in this crisis management. It also comes with an investment of money into the EU for Health program, which sits with DG Santé. But altogether, and if you can just advance a little bit, eventually the budgets that are associated with it will have to come from existing budgets. So we are somewhat worried, for example, in taking money out of Horizon Europe research programs, what impact it will have on other diseases. So to answer my question at the top, do we have a commitment? We have some. Where are we? And if I can have the next slide indeed. We do not have reached a full blast, definitely not. We are still in need of a health research strategy within a European Health Union with proper leadership. And I have put this around a structure that is currently not existing. We have HERA, we have ECDC, we will have a digital health data space, hopefully, but we do not have an organization for health research, which we propose as a European Council, that could then interact with other strong-led organizations in the world to ensure global health. And I give as example NIH with its leadership in the United States. And altogether, I would like to end by a recommendation that we build a forward-looking European Health Union with a strong multi-stakeholder supported scientific leadership that can then go in dialogue with the world. Thank you very much.
Thank you, Karin, SIPIDO, pour cette présentation et cette nécessité donc d'avoir un leadership.
Thank you, Karin, SIPIDO, for your presentation. Ole Peter OTTERSEN. That's the other way.
We have a duo, two speakers that will now enter the podium, or the screen rather. And so the next speakers.
Michel, KAZATCHKINE.
Exactly.
Yes, and Stéphanie CHIOMBIANO. Yeah.
And they represent what I understand is the only French think tank dedicated to global health issues. And that is the Santé Mondiale, or Global Health 2030 think tank. So we are very pleased to have Michel and Stéphanie on board, or on the screen, I hope.
Yes, indeed. Can you hear me?
Yes, we can hear you, but we can't see. Yes, it's perfect.
Hello, good afternoon. So thank you for the opportunity. So I'm here to indeed introduce to you a think tank, which we have called Santé Mondiale 2030, or Global Health 2030, and which is committed to be a strong partner to all of you as we build a European Health Union. We are a group of 15 plus people, including academic physicians, researchers from the biological and social sciences fields, colleagues from the civil society, including a prominent health journalist, colleagues from foundations, and also from the other areas of the private sector. For the last 5 years, or close to 5 years, we have been meeting every month, sometimes during the acute periods of the COVID crisis, twice a month, to discuss and reflect on issues relating to global health, with the aim of promoting global health in France, in the academic and institutional space, and also in the political space. So what we're doing is we're writing op-eds, we're present on social media, and we do draft memos that are primarily aimed at decision makers in our country. So let me say at this time, before I give the floor to Stéphanie, two more things. One is that we're fully committed to the dual aim of strengthening European health internally in the Union, so a stronger public health European Union, and also in strengthening the voice of Europe when it speaks to the world and when it brings and promotes European values in the multilateral debate on global health issues. And in that respect, we want very much to join all the efforts of the World Health Summit, of the Geneva Forum, Health Forum, and of the One Health Forum in promoting a European Health Union. And now I'm leaving the floor to Stéphanie Chiombiano from our think tank to give you a flavor of our recommendations. Stéphanie.
Merci beaucoup, Michel. Bonjour à toutes et à tous, et merci pour cette belle occasion, effectivement, de...
Thank you, Michel. Good afternoon, everyone. It's a great opportunity to present our recommendations. And our think tank came up with the following. So basically, we have a threefold and three-step approach, and to make sure that world health is governance includes Europe. Therefore, we must make sure that Europe leads a strategy in world health. We know that all problems are world problems and that the answers have to be collective, so Europe must participate in those discussions. This involvement is indeed to have a strategy with documents. Some were drafted in 2010. Member states must update those documents. Obviously, the situation has evolved since 2010. And some working groups started working during the Finnish presidency. So we must have a clear roadmap to make sure we know where we're going. Secondly, we must speak of one voice, and a common European voice must not be the lowest common denominator. It must be the common thought. Obviously, we need intra-European dialogue centers with researchers and NGOs and stakeholders, because we need to lean towards readable, legible objectives and make sure that we have a European health culture that apparently does not exist. And thirdly, we must invest in the multilateral governance agreements. Europe is represented at the board level, and I believe that Europeans and the EU would gain if they coordinated their positions every time it is possible. The European Commission should not be the 28th member state. It should speak on behalf of the 27 member states. And to conclude, I would like to insist that the European institution is the will of the member states. The European Commission will get involved if and only if the member states say so. So it is important that the forthcoming meeting of European health and foreign ministers leads to that voice. Thank you, Stéphanie. Let's move on to Simon KABORE.
It's very important in a session on the global perspectives to take in the perspectives from all parts of the world. I guess our moderator agrees.
C'est exactement ce que disait Stéphanie Tchiombino à l'action.
Exactly. And now we will have what we could call the African perspective from Simon KABORE. And I'm very impressed by the work he has been doing to take health also into a human rights perspective. So we are very happy to have you on the screen today on distance, Simon.
OK, merci beaucoup pour l'opportunité que vous me donnez.
Thank you for this great opportunity. It's a great opportunity to speak about the European health policies from Africa. It is quite obvious that with COVID-19, we are now all convinced that there is no borders for viruses, and we can all be impacted by an illness coming from far away. So it's not possible to have a healthy region and a sick region. So the logic is that we manage to have a healthy world, or else we will be in a world with enormous risks of illnesses. So we acknowledge the efforts carried by Europe, but I would like to point out two negative points and that will lead to recommendations. First of all, we think that Europe does not manage to deal with its internal conflicts of interest, when in fact a lot of standards, world standards, come from European institutions and are applied in our country. In our country, where we don't have enough to have our own standards, we are vulnerable because sometimes we cannot protect our own citizens. It is therefore important to ensure that world financing does not always force us to apply those measures, especially that sometimes we are not convinced that those measures take into consideration the protection of patients. Secondly, the European Union, during the debate to access to new therapy, the European Union positions itself to protect pharmaceutical companies. The USA actually wanted to promote access to vaccines, which is not necessarily the case in Europe. With the partnership, the economic partnership that are included, the agreements actually include protection of the patents. And that means that Big Pharma can actually catch up with what they lost at the level of the WTO. So our recommendations are the following. We wish that the European Health Union promotes the initiative of CDAO, West African Union, and the West African Union, so that we can develop our own evidence and we can adapt the world standards to the African context. If Africa had had that possibility, maybe we could have shared our secret of our resistance to COVID. Also, we need a commitment of the European Health Union to having a patent protection system less rigid, make sure there is not two-speed approach. Thirdly, we would like to be helped here to manufacture vaccines here, because we realized that India and China could not produce the copy of vaccines, and we suffered from that. And lastly, we would like the European Health Union to fight the flight of capital, of African capital, that could have actually helped in the manufacturing of vaccines, and this capital flight actually handicapped our countries and our global health. So those are our recommendations.
On voit toute l'importance de renforcer.
Thank you, Simon KABORE, and thus the importance of reinforcing the efforts.
At Makerere University in Uganda, one of the leading universities in Africa. And I think she will touch upon a very central issue that we're discussing here today. When we are hosted by the One Sustainable Health Forum, I think Rhoda will tell us what is sustainable health in a global perspective. I hope Rhoda is with us now.
Yes, please, and thank you for the opportunity to participate in this important discussion from Uganda. I hope you can hear me well.
Yes, very well.
Thank you. So, based on our experience from Africa, faced with a ferocious attack from the COVID-19 pandemic and the limited tools that we have had for a long time for prevention, for diagnostics, and for treatment, many of our countries were forced to choose between life and health, rather life and livelihood. But life without livelihood is not equal to health as we know it, because livelihood is such a critical determinant of health. So we need equitable determinants of health for equitable health. We need to address the broader determinants in the One Health approach, while at the same time preserving future generations in terms of their health and well-being. We need sustainable health. We need health today and health for future generations. But this should be done with full engagement, especially of our huge young populations who are our leaders for tomorrow, with the involvement of women and men equally. So it's not sustainable health if we don't cater for the health of the future generations, health today and health tomorrow. How can we achieve this? We need a global effort and global leadership for sustainable health. We need to invest in governance structures for collaboration, solidarity at the global, regional, national, as well as community levels. We especially need to invest in structures and systems that protect the most vulnerable, including community health systems, to ensure involvement of the most vulnerable communities and ensure context-specific solutions. In Africa, we need to invest and strengthen in the emerging structures. For example, the Africa Centers for Disease Control and Prevention for a joint continental effort. We need to also invest in the African Medicines Agency to improve access to quality, safe, and efficacious health products on the continent. We need to invest in equitable science, technology, and data to realize the full potential of the underutilized creativity and innovations within and across communities to the benefit of the entire humanity. And this calls for investment in a sustainable way in the network of academic research institutions and innovations hubs across the world, across the regions, and all communities in an equitable way. We need to invest in our young people to provide better leadership in a sustainable way for sustainable health. Thank you for the opportunity.
Merci Rhoda. WANYENZE, Simon KABORE nous parlait des brevets, vous nous parlez du partage.
Thank you, Rhoda, WANYENZE, so sharing and investing. Let's now move on to Amadou SALL in Senegal.
We'll continue on these lines that Rhoda drew up for us. How important it is to have production facilities, not only for medicines and vaccines, but for all purposes related to the betterment for health. And Amadou, it's great to see you here on the screen. So you are the director of Pasteur Institute in Senegal. So it's a pleasure to have you with us here. The screen is yours.
Thank you very much, and thanks for the organizer for bringing us. For the short period of time I'm having here, I just want to emphasize 2 or 3 important messages. And all these messages are based on the observation that we all know now, nobody is safe until all of us are safe. And that would imply to me, first, for Europe to be a safe place in terms of health, to value very much partnership. And when I say partnership, I'm talking about partnership outside Europe. And this is very important in the sense that today, what we want to make sure is that if there is any good technology happening in some place, it is applied in area where we can detect quickly threats and make sure we respond quickly to that threats. And in that, working with a different institution that can do that in partnership would be something absolutely critical. And when I talk about partnership, we're talking about having people working together, having some common goals in designing solution, and also making sure when it comes to public health, today people are talking about genomic surveillance. People are talking about making sure that we have equity in health. We build those partnerships to make that happen. And very specifically in the field of equity for access to health commodity, definitely making sure vaccine manufacturing, diagnostic manufacturing, and also therapeutics manufacturing happening in Africa in a self-sustaining way is absolutely critical. The second point I want to make is really the need to build some sort of solidarity with Europe. And when I talk about solidarity, it's critically important that when we build this solidarity, we talk at the community level. What is happening and that we see is today, everything that is doing, including vaccine hesitancy or being together to try to enforce some measure, has to do with behavioral change. And this implies that community feel like they're part of the same control and same battle. And by that, we mean that saying solidarity is something absolutely critical. And in this regard, the message that can be sent by some community, like where some can get access to vaccine while others cannot, is not to me a good message. And also learning from community and co-creating with them solution would help that solidarity happening, and beyond solidarity, having this trust really happening. The fact that we have this trust would make much easier every sort of global approach we may have to any problem for the global benefit. And the last point I really wanted to make was about making sure that innovation, and there is a lot of innovation happening in Europe, can be really spread out and be done in a way that it is benefiting most of the people. With Edge 2020, we see a lot of cooperation happening. And really, when we talk about Africa or other region of the world, we are looking a lot about leapfrogging model to make sure that the future of these countries are not really the past of Europe. We should have some leapfrog approach. And this innovation in terms of technology can play a critical role. I am, as part of Institut Pasteur network, I mean, at the head of a network which is covering 5 continents, including European institutions, together with the 4 other continents. And for me, it's an amazing opportunity for Europe through such a kind of network where they have some country and institutions that have been working for years to reinforce the link with what exists and develop them for the future. So that's really the 3 messages I wanted to convey to you, and thank you for your attention.
Merci Amadou Sall. Dernier speaker de cette deuxième table ronde, Ole Peter. It's
the last speaker is Agustin Martin Lacenta.
He's a senior advocacy officer at Global Development NGO, Deutsche Stiftung Weltbevölkerung in Brussels. So we are very happy to have you here, Agustin. Please.
Thank you very much. It is a pleasure to join you remotely and be joined by such an exceptional panel. In 2020, in response to the COVID pandemic, together with a group of development NGOs, we put together a proposal for a global health strategy in the EU. The recommendations I'm presenting today come from this paper, which I just put in the chat. It has never been a more important time to assess and rethink the role and responsibility of the European Union in global health. But like in many other areas of European Union integration, it is essential to compare expectations and capabilities. The pandemic has triggered many expectations in the EU's role on global health, both domestically and globally. But are those expectations truly in line with the actual capabilities of the EU? Stéphanie has eloquently spoken before about the absence and hence the need of a global health strategy in Europe. Indeed, without a common understanding of global health, a plan with earmarked resources and clear deliverables and timelines, the role of the European Union in global health will still be essential, but also reactive, fragmented, and incomplete. Such strategy should have, at least in our view, 3 important features in order to be a true policy and not just a political aspiration. First, it has to be developed with experts. I hope today's recommendations are just the beginning of an inclusive debate with NGOs, academia, and other stakeholders. A dialogue not only among Europeans, as has been said, but globally. For that, the EU needs a genuine platform to engage with stakeholders. The Global Health Policy Forum played an important role in facilitating such dialogue and therefore should be rebuilt and revamped. Second, such a strategy needs to be anchored on clear and focused areas in global health equity and unmet public health needs. Health system strengthening cooperation with Africa, including African strengthening and harmonization of medicine regulation, and of course the establishment of the African Medicines Agency, as said by Rhoda and Simon before. Research and innovation on poverty-related and neglected infectious diseases, such as HIV, tuberculosis, malaria, neglected tropical diseases, antimicrobial resistance, and other areas where there's a clear market failure, both at regional level via existing partnerships such as the Global Europe EDCTP, but also at global level, such as via the Coalition and Epidemic Preparedness Innovations, CEPI. And of course, that strategy should focus on the realization of the SDGs, as mentioned before, by accelerating and increasing support into areas. Il va pas falloir que tu me le fasses à partir de maintenant, là. Healthcare, universal access to water, sanitation, and hygiene, and other critical areas. Next slide, please. And third, and to conclude, a new global health strategy must include an investment plan that mobilizes additional resources. As Karin mentioned before, the new EU health strategy such as HERA will rely on existing funds, and the impact of this reshuffling of funds remains unclear and potentially problematic. So we need more resources for global health in the EU if we are to match expectations with capabilities. A quid among epidemiologists is that when it comes to epidemics, it's not a question of if this will happen again, but of when and how bad it will be. And a popular saying is that humans are the only animals that trips twice over the same stone. The first stone could have been 2003 SARS outbreak, which resulted in the creation of the European CDC. The second could have been the Ebola outbreak in 2014, or even the Zika in 2016, but we trip again. There are many stones in the way of constructing a European health union. Let us not trip again over the same stone of neglecting global health in the EU. Thank you.
Thank you, Augustine, Martin, Lassane. On voit l'urgence de construire solidaire et équitable.
Thus, the emergency to actually invest and find a Peter, in order to conclude, let's listen to two students, Max Karin and Rose Taylor.
Ils sont de la London School of Hygiene and Tropical Medicine and Royal Veterinary College en Angleterre.
Hi there, thank you very much for including us today in your event. So I'm Roz and this is Max, and we're both master's students in One Health at the university at the Royal College, Royal Veterinary College and the London School of Hygiene Tropical Medicine.
Yes, so thank you very much. Through our ongoing training and the current context of the pandemic and climate change, I think it's been mentioned previously that we realize the limitations of the fragmentation of our systems, and this has pushed us to forget what the primary objective should be of development, and that is better health for all. As previously mentioned by others, this can only be achieved by addressing the sectoral interconnectedness of our society. This should be integrated in policy as soon as possible, and also very importantly in training future generations. This is where we can relate and where we suggest a European One Health university network, which could be in partnership and adapted from the existing Africa One Health university network. This could be a contextualized framework to shape future leaders with the transdisciplinary skills and awareness to address health-related issues nowadays.
Yeah, and we hope that this framework could facilitate skill sharing and discussion between generations, but also across sectors and borders, not only explicitly within global health-related modules, but within related areas such as economics, policy, pharmaceutical studies, and more. This could, for example, take perhaps the shape of seminars, guest lectures, and skills workshops, and with the view to challenge perspectives and norms and advertise opportunities, not just for individual, but for institutional progression.
So thank you very much for having us. Thank you for including the student voice, and best of luck for the rest of the event.
Merci à tous les deux. Avant de passer à la troisième table ronde.
Thank you. And before moving on to the third round table, I would like to summarize that second round table.
The student voices told us, not least now, and Ross Taylor. What they said is that we need better health for all. And in fact, all is the magic word that the entire discussion revolves around. And I think what we have learned from this session is that when we speak about better health for all, we should have at least 3 dimensions in mind. One, of course, is the time dimension that we have touched upon several times. We have responsibility for our children, over future generations. And then, of course, climate and planetary health enter the discussion. On this small planet of ours, there is no room for more than one health. The second dimension that has come up time and time again, I think, in this session is that if we reflect upon what is better health for all, we have to consider equity, solidarity, and we have to think across geographical borders. So these are the 3 perhaps most important dimensions that we have touched upon in this session. But there is one other issue which really is a challenge that also pervaded many of the speeches and talks here today, and that is the cross-sectoral dimension. And that is perhaps one of the most difficult ones. How to safeguard health across all political sectors. So then we go back to the first presentation. Certainly we need a multi-stakeholder platform, not least here in Europe, to ensure that we get this cross-sectoral approach to health. That, I think, is one of our major challenges. And I think it's our responsibility to continue the discussion on how to tackle this challenge. So this is a very brief summary from this session, and I guess we will get back to many of these issues later on. Thank you very much.